So, Jyoti, when it comes to myeloproliferative neoplasms, what are the classic or the spectrum of signs and symptoms of these diseases?
That's an interesting one, and we see such a variety in clinic. Going from one end of the spectrum to the other, we have individuals that are referred to us by their primary care physician, and they don't really know why they're there or why they need to be there. The blood counts have been done for some other reason. For example, just a healthy man or woman check at particular ages in their life or during pregnancy, or for any other reason, and they've come up as being abnormal, and that has then led them to a hematology clinic and a diagnosis of one of these conditions. So, on one end of the spectrum, I'd say individuals feel entirely healthy and are symptom free. Somewhere in the middle are individuals that have some symptoms, but they're not um, interfering with their life. So that might involve a little bit of fatigue, a bit of itching, particularly after heat or a hot shower. Their skin may be very red in the context of polycythemia vera. And sometimes these symptoms, the individuals feel are normal for them because they've had them for so long, but perhaps friends and family have noticed them on behalf of the patient. Beyond that, some of our patients present because they have had a thrombotic event. So that may be a deep vein thrombosis or blood clot on the lung. It might affect the heart, the brain, some of the abdominal organs. And sometimes they're diagnosed when individuals are actually in hospital being treated for a thrombosis that has occurred um, seemingly out of the blue, and then we notice that the blood counts are abnormal, and there may be one of these conditions driving it. And then, really, at the other end of the spectrum, individuals can have thrombosis, bleeding, they can have weight loss or bone pain, poor appetite, night sweats. Because their disease is advanced, perhaps their liver and spleen are enlarged, their bone marrow is not working as well as it should. And as a result, it's really impacting on their day-to-day life. So I would say it's a huge spectrum, but in my experience, um, I'd say many of our patients present with not many symptoms at all.
And with symptoms being something that we really kind of characterize within myeloproliferative neoplasms, there are different kinds of tools, right, to establish and follow these symptoms over time. One of which is the MPN-10 or this total symptom score, and how is that best kind of used in practice?
The MPN-10 is a great tool that many patients find useful because it allows individuals to track several symptoms, be it abdominal pain, itching, tiredness, concentration, and track how that is day to day or week by week. Patients can do this as frequently or infrequently as they like, and it can help them reflect on whether they're having a good month or a good year, whether things are improving or getting worse once treatments have been started. And that can then help that conversation with the hematologist to guide whether treatments are working well, or indeed we need to start treatments or think of other treatments. It also allows communication between patients and clinicians because often you don't know you have a symptom until you've had to think about it. So, for example, some patients don't realize they have quite a lot of itching because it's normal for them until the itching then goes away and they realize it was related to the disease. So the MPN-10 is one such symptom score. People use it in different ways. They can be sheets of paper that people fill out, perhaps every consultation, or they can take a diary home with them and fill it out in their own time at a particular level of frequency. And sometimes you even have apps on phones or watches where individuals can collect the information in their own time, and that information can then be visible to clinicians.
Yeah, I think it can be quite helpful for patients to follow these symptoms over time. And I think that myeloproliferative neoplasm clinical research has been kind of a leading area where these symptoms are actually driving approval of medications, right? And the use of medications. And so there is a focus on understanding quality of life and having that be a very meaningful endpoint as we develop agents that can improve patients' quality of life. So thank you very much for that.
Yeah, that's a great point you raise. Many of the drugs that we use in myelofibrosis, their outcome is measured by how well they treat symptoms. And if they significantly improve symptoms, they're deemed, a success, and then that leads to licensing so that we can access those drugs to treat more patients.